Good morning and good night, good afternoon, everyone. Welcome to the 2021 Lancet Countdown on Health and Climate Change U.S. Virtual Launch Event. My name is Tia Williams, and I am the Director of the Center for Public Health Policy and Center for School Health and Education at the American Public Health Association. It is my pleasure to kick off the event by introducing our opening keynote speaker, the Deputy Administrator for the U.S. Environmental Protection Agency, Janet McCabe.
Hi, everyone. Thank you for inviting me to speak on this exciting day for the Lancet Countdown and for all the experts and organizations who supported your efforts. I want to start by thanking each of you for all your advocacy on climate change. Your work on the U.S. policy brief and your voices are essential to helping all of us make the connection that protecting public health and protecting the environment go hand in hand. Each scientific report that comes out adds to the body of knowledge about the impacts of climate change and is another opportunity to make connections for policymakers and the public about why we should care about addressing this huge threat to humankind. Your focus on drawing the lines between climate change and public health is one of the most critical, and the credibility and influence of your organizations makes your work all the more important. At EPA, we couldn't agree more that we need to implement a comprehensive response to climate change that prioritizes health and equity. It's such an important message to send to the American people, and it's one that President Biden reinforces and we reinforce at EPA every day. You've probably heard the president talk about how he's employing a whole of government approach to addressing the climate crisis. What that means is that every federal agency is working, and we are working together to infuse climate change and racial equity into all aspects of our work. It's really an unprecedented way to confront the challenges we're facing, and I believe it is what will make us successful. At EPA, we're moving with a sense of urgency because the health of our communities and our economic well-being are at stake. We're taking aggressive action to get the Clean Cars program back on track, to phase down those super pollutants, hydrofluorocarbons, to deliver a strong proposal to reduce methane pollution from the oil and gas sector, and to help our communities prepare for the impacts of climate change. Our efforts will help cut harmful emissions that cause climate change, clean up the air our children breathe, and ensure healthier communities across America. As we work to accelerate progress on climate change, we're also keeping human impacts and environmental justice front of mind. For decades, Black, Latinx, Indigenous, and low-income communities have suffered from disinvestment, inaction, and environmental injustice. These are the same communities who face higher rates of heart and lung disease, whose children are more likely to develop asthma, and who are struggling under the weight of the pandemic. We cannot allow these health disparities to persist. President Biden signed an executive order that pledges to prioritize environmental justice and to advance a systematic approach to racial justice, civil rights, and equal opportunity. At EPA, under Administrator Regan's leadership, we're incorporating environmental justice into every aspect of our work, including our regulatory, permitting, and enforcement activities. Correcting these longstanding health inequities is our responsibility. President Biden has also called for billions of dollars in new funding through his Build Back Better agenda to help support communities across the country as they anticipate, prepare for, adapt to, and recover from climate-related changes in weather and the environment. And just last week, EPA issued its Climate Adaptation Action Plan, which describes the steps the agency will take to address the impacts of climate change on our communities, from fires in the West to widespread drought and the wide path of destruction left by Hurricane Ida from Louisiana all the way to New York. It is crystal clear that our changing climate is having an impact on our lives and our livelihoods. And this is where the work that you've done in your policy brief is so important. It brings to life the challenges we are all facing. It's not just one part of the country, one community, or one family. We are all facing health challenges that are directly related to our changing climate. Thank you again for having me and for the work that you've done. We have an ambitious agenda to fulfill, one that is deeply focused on ensuring the health and well-being of every community in America. Congratulations on the publication of your policy brief. We look forward at EPA to continuing our partnership and our collective efforts.
A huge thank you to Janet for those insightful remarks. I would now like to introduce you to Dr. Marina Romanello, Research Director at the Lancet Countdown, for her welcome remarks. Marina, take it away.
Thank you, Tia, and thank you everyone for being here. It's an absolute honor to be here representing the work of the Lancet Countdown. I'm going to try to share my screen, and please let me know if you can see my slides and put them on. There we go. Are the slides showing? There we go. Awesome. So I'm here to give you a bit of an overview about what the Lancet Countdown is and our latest report, but I know that Dr. Jeremy Hess will dive a bit deeper into it. The Lancet Countdown is, at its very core, a big research collaboration that tries to pull together the lead research scientists and UN institutions from around the world. We are today 43 institutions from leading academic universities, UN agencies, and other research institutes. And you can probably recognize here quite a few that come from the US. We're an enormous research family. We have over 120 global collaborators. We used to meet in the flesh yearly. This is the last meeting that we had previous to COVID. But since the pandemic, we've shifted to an online world. And that has brought us a lot closer, actually. We are now in contact on a daily basis with researchers from around the world, researchers in the US. In particular, we have a huge family there as well. The work of the Lancet Countdown is captured through annual reports. We've been publishing yearly reports in the medical journal, The Lancet, since 2016. But before that, the collaboration that gave birth to the Lancet Countdown published two commissions. The first ever commission published by the Lancet that concluded that climate change is the worst health threat of the 21st century. That was in 2009. Just in 2015, 6 years later, the second commission on climate change and health concluded that climate change is the biggest global health opportunity of the 21st century, because by tackling climate change, we can actually deliver on many actions that are essential for good health. We can deliver better quality of air, reduced air pollution, better diet, more physical activity, better and strengthened health systems. With that commission and highlighting the opportunity of the co-benefit of accelerated action on climate change is that the Lancet Countdown was born. And this year is the 5th year in which we have been publishing our annual iteration of indicators. We have 44 indicators developed by over 90 scientists around the world. And this indicator tracks the world as it's moving from climate change as a threat to health to hopefully an opportunity to improve our health. We have indicators that capture the health impact of climate change, that look at how health systems around the world are adapting to these health threats, that look at mitigation of climate change and what co-benefit that brings for better and improved health and well-being, and also looks at the economic, social, and political context which enabled that transition. In our latest indicator, we have exposed inequities by looking at our indicators from the point of view of the Human Development Index developed by the UN Development Programme. We have also addressed gender inequities, and we have, above everything, given an updated and more rigorous assessment than ever before of the state of climate change and health. The conclusions of this report are quite dire, I should say, and I know that Jeremy will dig a bit deeper into this. But what we're seeing is that this report is really a code red for health. We're seeing that the symptoms of climate change are worsening in every single indicator that we're tracking. And we're seeing a very slow response from the world, not taking advantage of this enormous opportunity. But in the lead up to COP26, when we're recovering from the COVID pandemic and when we have this opportunity of rebuilding our economies, we are now in a pivotal moment where we really need to act. And it gives us an opportunity to really deliver on all the health benefits and the mitigation that we've been trying to call for so many years. In this, it is hugely important the work that our collaborators from around the world do in developing policy briefs to translate our scientific and research findings into policy recommendations that we can give to the hands of policymakers to ensure that they drive change. Obviously, the US policy brief is an enormous achievement and is critically important. The US is the biggest emitter of cumulative greenhouse gas emissions in the world by far. So the role of the US in leading the way here is absolutely crucial. So we welcome the work done for this policy brief, and thank you all so much for being here. And without further ado, I will hand over. Thank you.